recording. We got it.
We don't want to lose any pearls here. Yes.
All right, we are recording. So, almost all of you have been here before. And for those that haven't been, you could check in with the others to figure it out. So we went through this fire service EMS vision thing. Now we're in our 5th week. And as you'll see when we bring up the slide presentation, what we're talking about, and we've started the SWOT analysis, we're now to threats. So before we get started the discussion, and by the way, who did I see was first? Ryan Thorne, be ready to go once I get done my little preamble, because I'm going to let you open up with the comments that you have. So I just want to give a quick overview. One, I have another webinar at 1:30, so I think I could leave this up and let you go, but at 1:30, I'm jumping off. So just a rehash of what we're here to do.
So one second, Tony.
Yeah.
Someone's got a lot of noise behind them. If you're in a car or something, can you please go on mute?
Yeah.
Thank you.
Everybody, yeah, if you could go on mute until it's your turn to talk, I appreciate it. And you all should be able to unmute yourself. So we're trying to look at fire and EMS, where we're going for the future. Most of you get this. And, I actually just saw there's an article in GEMS now from several about strategic planning. I got a feeling we're ahead of them, quite frankly, but this is what we're doing. Whatever this comes out of collectively as a group or individually, if somebody benefits, an organization benefits, if collectively we actually do something that's formidable, awesome. But at least we're having a discussion, we're sharing ideas and comments, and you're meeting some new people, which is all great stuff. And the goal here is to get to that point. And while it's good to have debate and discussion and even some dissension, the goal is to get to yes. What is yes? I'm not really sure yet. But yes is a vision of the future of where fire and EMS can be better, because they understand what their threats and weaknesses are, so they could use their strengths and opportunities to move forward. So after today, and we're going to do threats today, after today, what I think we can do is we can already start thinking about strategies. And what I would like with strategies is start, and I don't know how we're going to do this, you could all come up with ideas, but form groups of people that actually work on blocks of strategies so we can be more productive. This shirt I have on, I don't know if you can see it, it's a Barton Hills Choir. It's a youth choir that's out in the Austin area, if you're in the Austin area, and there are a bunch of kids that have been picked, I guess, because of their talent, and their only job is to create some great music, and they use a lot of musicians. They started with the Grateful Dead, but they do a lot of other musical groups, and I use these because this is a good example of people just coming together to do something better, to make the world a little bit better. So today we're going to start with threats. I'll put up the slide presentation in a minute, and then I'm going to turn it over to Ryan. So actually, Ryan, you can get started as I start to share screen. Oh, one last thing. Emails, if you haven't sent me your email, we've created both a Dropbox account, which has all the videos and the transcripts for the last 3 discussions. We'll have this 4th discussion on it. And I also have a Google Drive that has this actual presentation and the working document that we're putting information in. So make sure that between myself or Nick or Jonathan, we get your email so we can add you to that, so you can look at all this information and find, if you've missed something, you can pick up on it. So
and we're also going to post it, of course, to the Facebook group and et cetera.
Right, yeah.
Make sure it's fully accessible to everyone.
Right. So Ryan Thorne, get started as I put up the presentation here.
Okay, sounds good. Well, I'll start by saying good morning or good afternoon, depending on what part of the United States you are calling from. So I guess for Jonathan, it's more good morning than it is anything else. My screen just changed again. I actually, over the past week here, have been definitely thinking about the threats. It's definitely something we, as an organization here in South Carolina, we've been looking at within our own company.
This is the one I was talking about.
What's that?
Okay.
Listening to
What are we talking about?
So, so what we have here is I've kind of come up with a list of 8 items, and I'm just going to touch on a couple of them because I know I've already seen in the comments a couple of others that have popped up. I already saw ourselves, which is on our list, and actually may be our greatest threat. But what's of interest to me is the fact that many of the opportunities that we discussed last week are also very much the potential threats that we face as an industry. And so that's where we really need to, I think, focus our energy and our talents and resources to. So one of the biggest things for me when people ask me kind of what separates our organization from many of the others is oftentimes surrounding culture. So I think when we take a look at the threat to our industry being that of management and culture, and the fact that management really has the ability to drive the culture that we are creating and promoting within our organizations. And so that really needs to be kind of one of the things we do both internally as an individual entity and also as an industry to look at what is the culture of our industry and what is it that we're really trying to promote and push out there as our message and as the culture that we are looking for within our workforce and within our industry. Another thing is the failure to be forward thinking. You still have a lot of people, I think, that have the Hearst model of EMS in mind. They still think that this is this old school taxi cab type mentality that we simply provide the ride to and from where you need to go. And so their inability to have a vision for the future is not exactly an issue that I see within this group, but definitely within our industry, that we still have those who are wanting to remain kind of behind the times, when we all know that in order to properly advocate for the advancement of our industry, we really have to be forward thinking and start to have a vision for the future. I know we've hit on it before, so I won't really spend a lot of time, but lack of unified advocacy, having that singular voice that we take, especially to the decision makers in our country. Another thing is the failure to professionalize our industry, whether that be through education, the terminology we utilize, or our identity, such as what we call ourselves. Lack of unification, lack of globally accepted minimum standards for EMS agencies, all things that I've kind of heard over the past couple of weeks that we've touched on a little bit. And then also the rising costs that we have coupled with the stagnation of compensation for services rendered. So the compensation structure itself is a threat to our industry, considering that our costs are going to go up whether we're ready for them to go up or not. And we have to have a game plan or start building out a better model of compensation. I know we've kind of gotten away from that reimbursement terminology and gone more toward compensation. And so focusing on that is a real threat to our industry, not only now, but in the future. And then we also have our workforce challenges, which is the inability of prospective EMS candidates to see the real value of the services provided by our industry. Now, I was in a meeting yesterday with our field training officers, and one of the things we talked about was the fact that you can make the amount of money you make with my company working for Chick-fil-A and have better hours and have Sundays off. So we really need to get back to this notion of EMS as truly a service and really seeing the value in what it is that we do and making sure that we're adequately promoting the value of the industry to get more people involved and engaged in the workforce. And then ultimately the last one, and then I'll be quiet, I promise. The regulatory changes that could negatively impact our industry or a portion of our industry. And I use the private service because that's where I'm at right now, but the private side of the industry I'll use. There are a lot of things that happen that negatively impact the private sector that don't necessarily impact fire departments or public EMS entities. But the reality is, when one of us is negatively impacted by any regulatory changes, we are all somehow impacted by that. And so again, it comes back to that whole idea of unification and that idea of advocating for the entire industry, regardless of what segment of the industry that you're in. And so those are kind of the points that I thought of throughout the week, and appreciate the opportunity to kind of open up the conversation with that.
Awesome stuff. And I think as I already start reading them, I start thinking of how we could work on some of those strategies. Well, you start out with culture, and Jonathan and I talked, and you all were on last week, and we had a lot of discussion about, I got to admit another one. We had a lot of discussion about health and wellness. And one of the keys that I took away that I think that we really need to put at the highlight of this whole list, as far as strategies, is overall taking care of our people, however you want to do it. And just a funny little thing, it's not only private EMS that gets hit with poor pay. I was a fire chief in a department when I was in Missouri that they made more money in McDonald's, so fire and EM, it's not as much, but you're right. And there is collateral damage. One of the things I didn't say in the outset that I was thinking about was, years ago, Apple was on the balls of its butt, and Bill Gates decided the biggest competitor, he could have buried Apple. Apple could have been closed. I wouldn't be on this MacBook right now if he didn't help him. But he saw the collateral damage if they let that go. And so one of our weaknesses, I think I agree with you, is we're not open to the idea that, hey, if I bury this fire department or I bury this private service, I'm going to be better off. And that's not necessarily true. Think we need to see where, as we've said under Unity, where we can collaborate first before we worry about competition. Good start. Who do we have next? Anybody up there next wants to go? Raise your hand, put it in the chat. Let me know. Well, Jonathan, I guess you could go with what you have and what Amy put up.
Sure. Well, and I'll add a little bit before that. I think let's we can certainly dig right into what Amy said, but I think I want to touch on the culture bit because it's come up a lot, and a lot in some of the sidebar conversations that I've been having over the last week. And by the way, in and of itself, I think that's actually a remarkable. Sorry, I just noticed Joe's logo. Can I have that picture, Joe?
Yeah, that's from my Revenge of the Fifth after May the 4th.
I'm just gonna put that somewhere in my house. My Mexican
Star Wars Cinco de Mayo mashup for down here in Texas.
Dude, you win the day today. You win the internet today, just for the record. So I think, Tony, it's been a wonderful thing, the amount of conversation that's leaked beyond this conversation over the last 3 weeks. And so one of the things that's come up is this topic of culture. And I think culture is a complex thing. To sort of a casual observer, it's, the way you engage with your colleagues, I suppose, or with each other. But it actually goes far deeper than that. And those of us like me, I have a degree that encompassed sociology. We understand that sociology and psychology and those social factors are far deeper. A lot of it goes to the way that people view themselves and the types of groups that you pull together. For example, I'm going to get a little academic here. The fellow named Emil Durkheim, who's widely seen as the father of sociology as a social discipline, made a mistake in his early work. And in that work, he talks about the idea that if you put a group of people together, his magic number was 10, culture emerges. And the idea is that culture, like a corporation, is greater than the sum of its parts. And actually, that's where some of the concepts for corporations come from. Is this idea that you put these people together and something jumps out of that. And that thing goes beyond the individuals who are there. But the problem is that's wrong. Right? If you put 10 open-minded people together, you get an open-minded culture. If you put 10 Nazis together, you get a Nazi culture. Like it has not, the idea that it's divorced from the people who make it up is simply not true. And I think that's one of the things that we're seeing here. The people who are self-selecting, there's 30 of us now, right? So, and I think this number is going to rise over the course of the morning, but we have 170 people self-selecting in a Facebook group, plus however many people inside our organizations. I saw Zeke, for example. Zeke Peters is on this conversation. Zeke is an example of somebody who is spearheading conversations inside an organization that touches a lot of people. So I think the idea that if we can use this forum and recognize that culture involves economics, it involves job protectionism, it involves a sense of how we take care of ourselves and each other. Of course, it involves all of that, but a lot of it also again has to do with messaging. And I spent about an hour, maybe more than an hour, on the phone yesterday with Amy before she posted those things. In fact, I strongly suggested that she post them because we were talking about these topics. And for everybody who's wondering, we'll get into it, but it has to do with some of the fire versus EMS dynamic at the organizational level, at the union level, and even the fact that EMS doesn't have a union. It has a ton of little splinter agencies, associations, whereas fire does not. That is a cultural aspect of if I disagree with the way you're handling something, instead of coming up with, I don't know, either a democratic approach or a consensus approach or trying to convince somebody, I'm going to go start my own association. Okay, that's an approach, but it leads to certain, other effects. And so there are, I think there's a lot of things that get wrapped up in something really small, like culture as a word, but it actually encompasses a ton of what we're talking about. So I think we should dig in on that, because the threat of culture as something simple is a threat in and of itself. It is a deep conversation that needs to be unpacked, where you can't simply say, free food on Wednesdays, right? Or we're going to put sombreros on lightsabers together. Those are aspects of culture. And they're important, right? The image that we have of ourselves and each other, what you wear to work, what you wear, how you engage. There you go. But the respect with which we engage, right? But at the same time, when we talk about things like degrees, I think, and I'm just going to end with this, I think the degree conversation is very, very interesting and very important, but it is remarkable, how some of the people who are engaging in the conversation around whether or not people should have a degree can be some of the rudest and most defamatory, throw you under the bus people, which is almost the exact opposite of what academia is supposed to be. Right? Academia is supposed to be an embrace of ideas, and science is supposed to be about arguing to get to truth, not about throwing you under the bus because I have a higher degree than you do, or what kind of degree you have. And so it says to me that there's something much more there, because it's bubbling through these conversations where one thing is masquerading for something else. So I think that's worth talking about today, because if we don't rip apart that onion, something underneath is going to continue to show through. But it requires a lot of respect and sort of mutual courtesy and holding each other's hands, recognizing, as Ryan said perfectly, we're all moving toward the same goal. We are here because there's a mission. We could make more money elsewhere. We should talk a little bit about the money thing, by the way. I think that matters. But if you recognize that you have that common thread, then it allows you to have a common basis of respect. And that is something that particularly social media allows people to go without. But when you put people face to face, like we're doing here, or face to lightsaber in Joe's case, he wins the internet. Then it allows you to recognize that the other is not so different than you. And I think that's a really, really important piece that gets lost here, especially when we start talking about red versus blue. And at the end of the day, it's all about taking care of patients. I see people, Gail's face just showed up on my screen here again. And I think Gail is one of those perfect people that I love. And I have an enormous amount of admiration for this woman. If you don't all know Gail, you should. She will just hug everybody. It's amazing. But she is somebody who works as a nurse inside a fire service. And so and multiple fire services, and it's always been very telling to me that when folks talk about who cares more about patients, I don't know. I mean, I don't think you can have a fire versus EMS conversation, because you have people like Gail inside fire services, and then you have EMS agencies that call themselves patient-centric. Okay, so that kind of sets a common bar for these various organizations. It gets far deeper than what color your patch is. And that's it. I'm going to leave that for now.
Yeah, so great point. And I've brought this up before, and I have to bring it up again because it fits. And I don't know, do I have tribal leadership up here? Tribal leadership is not sitting there. If you haven't gotten the book Tribal Leadership, I recommend it, all of you. The key to successful stage 4 and stage 5 tribes, but stage 5 tribes, look at them as being Jimmy Carter and Habitat for Humanity, is to be aligned on strategic values for a noble cause. And our culture is built around that. And if
the park has already canceled our tickets.
If we worry too much about all the other extraneous things, like you said, if we're fire, if we're private, if we're nonprofit, if we're government, if we wear blue shoes, if we wear red shoes, if we're in delivering the service, if we're aligned with strategic values, our values are all the same, and we only have one, is unity right now, although I think service is another one, and the third one I see is vision, but you all can figure it out. If we're aligning on them, what happens, all our differences go away, because we come back to align on those we align on those values, and that becomes our culture for that tribe. And there's a lot of little tribes and a lot of little teams in a big tribe, and it's a good point that we really need to not only discuss, but we need to put it into strategies. We need to see how we address that. And I'm going to have some of my perspectives, again, looking at the tribal leadership process. And if you haven't read the book, they interviewed and assessed over 26,000 employees in over 24 businesses. It is a research-based work, and I have found it particularly valid. And I hate to say it at this point because it'll be a jinx, but I think we're working at almost a stage 5 tribe. We really are, because the people who come on here have shared values for a noble cause of moving fire and EMS forward, despite who we are. So I just want to leave that in a discussion, and I'm going to go to Nick, and whoever wants to go after Nick, we can go from there. And Eric Chase has some good comments. You should see it in the comments. Nick, you're up.
Awesome. Hi guys, happy Friday. Holding it 30 strong, nice. It's a little warm for a long
You got an echo, Nick.
You got an echo, Nick.
You got an
Hold
echo.
on.
Yep.
The kid's supposed to be the technology geek.
How about now? Can you hear me now?
Still an echo.
Damn. Okay, Tony, go to someone else and let me see if I can't fix this.
All right. Who wants to go next? Eric Chase had some comments. Anybody else? Alan Shaw. Somebody jump up, say hi.
I can go, I guess.
Go, Alan.
All right. A little bit of, I'm trying to think of a way to start this. I guess my focus is a little bit has changed since we've been having these discussions. The first thing I was thinking of was really how we were going to look at changing standards. If my N95 mask is suddenly good after 10 years, should we revisit if my turnout gear is going to be good after 10 years? Now we're looking at coming down off this 9/11-like high where everybody's talking about hazard pay is the number one thing we got to get for the first responders to, well, we're not really going to be able to keep as many first responders employed. And we're looking at pay cuts, we're looking at layoffs, and some of the things, we've got a couple of towns in Connecticut that outsource their dispatching to other towns. Are they ever going to get that back? Who knows? And the problem is we've got, somebody else talked about the culture here, but we've got kind of intertwining culture. I put it in the comments or in the chat. We've got internal stuff, fire versus EMS, paid versus volunteer, and we're all trying to carve out our little bit, and we're now going to be finding ourselves in competition. You've got management that if they can do something for cheaper, they will. And there's at least one department in Connecticut that just hired paramedics, single function paramedics as a part of the firefighter paramedics they had. So they know that the call volume says, absolutely, we can hire these guys. And management says we can pay them less than we pay a firefighter. If we're starting that with new positions, I wonder if EMS existing positions are going to be able to argue successfully for any sort of better pay or even parity. Look at the issue going on right now in New York City, where New York City EMS is trying for parity with fire and police. I think it was Ed Koch when he was mayor who once said there's 3 emergency services: police, fire, and sanitation. So we're looking at that. Then we've got the public who really doesn't know who we are or what we do because we've never really invited them in to see who we are. EMS, I think, is going to be in a better position than fire because EMS being part of healthcare, there's other functions that we talked about last week that EMS, in theory at least, has the opportunity to expand into. Fire kind of has an uphill battle trying to expand into anything else. We've already expanded into rescue and hazmat and that stuff, but is there something else we can do? And I'm not sure really what that is. But I just see somebody put up McJobs. It's funny. I used to be on a website for volunteer firefighters where there was a guy who posted what he called the McDonald's theory for fundraising. He talked about a lot of departments that were stuck in the past running the same bingo or the same block party. as a fundraiser, and he said, divide up the number of hours your members put into it and see how much your people made an hour. If it would be cheaper to tell your volunteers to go get a job at McDonald's and just turn their paychecks over, then you're probably doing fundraising wrong. And, you know, it's funny, look at how McDonald's is placed in the market share, that we use that make anything. You know, we definitely understand McDonald's and how they've built up their company. I almost wonder if it's possible that that could be something we could do. Can we build up to that theory? Can we get the market placement that McDonald's has? I don't know how to do that, but might be something to think about.
You have a good point. You talked about it. One of our opportunities, and it's a threat, and we're not using it because we don't use it, is to look more into other industries and see. We might not be able to use all of them, but we can use some of it. So great point.
Can Alan, can you clarify that last bit about creating a marketplace? I want to understand a little more about that.
I'm not even sure if it's really creating a marketplace, maybe utilizing it. Like, you know, we talk about how people don't really even know sometimes, especially in EMS, what EMS does. I remember a woman coming into my old volunteer firehouse, and she was telling me that you guys were on a call when I needed help, and 911 was there too. Well, what she meant was the ambulance. Now, I laughed when she left and said, well, actually 911 was there because I was on the rescue truck, but she has no idea I was a dispatcher. And she just didn't know what the ambulance was called. She didn't know, this wasn't even just EMT versus paramedic. She had no idea what EMS was. It was just 911 was there. But, you know, when you think about McDonald's, you go down the street, we've all seen the Golden Arches. We know exactly what it is. They offer a consistent product. A Big Mac in Wyoming is the same as a Big Mac in Connecticut. And
I don't want to steal the order at all, but I think it's an interesting observation I've had in talking with folks like investors. I find it remarkable how many people believe that all of mobile medicine is however it is in their backyard. So if you're here in California, for example, there is an assumption that AMR is everything, or your fire service, right? Because folks who live here see what's here. So I think because you're talking about branding, right, is ultimately what it comes down to. McDonald's is the same everywhere. Whereas how many different, trans cares are there? How many different gold crosses are there? And they're not the same. I don't want to take it out of line, but I think you make an interesting point that's worth talking about in the context of even defining terms, right? Brands overlapping. We need, is the star the right logo? You've also got a caduceus. You've also got a C around a shield, right? So brand consistency is, I thought, some of what you were talking about.
Well, it is. Although it's funny when you bring up logos and brands. I've always been a big one for having your own brand. Around here in Southern Connecticut and other places in the fire department, it's very common for your department to pick a patch that looks like a big city. How many patches have we seen that are basically FDNY's patch with maybe our skyline in there or our unit number in there? And I've always said, why are we doing that? Can you imagine anyone ever saying all burgers must be sold under the Golden Arches? Burger King, you'll have to come up with a variation of that. Five Guys, you'll have to come up with a variation of that. So it's okay to have your own brand identity, but we also still have to recognize that a hamburger is a hamburger. And I think to a certain extent, that's going to be kind of what Pro Board was trying for with fire and National Registry was trying with EMS, but we're going to have to get to the point where an ambulance is an ambulance, a fire engine is a fire engine.
Good point. And Prutz is available. He's moving, so we'll let him go. Chris, you're up.
Can you guys hear me? Is there too much noise? I'm on the road.
We could hear you. It's nice and clear.
Okay.
A lot better than the kid, Nick, with his technology.
Roger that. Appreciate the time. Just to kind of discuss and follow up with what was just said, I think what we're missing as an industry is something the fire service has done an extremely good job of, and that is the ISO office's public protection classifications. You can be EMS agency X, fire-based, EMS agency Y, hospital-based, private entity, county, third city service. And we can all argue back and forth about the level of quality of care and those types of things, which is really controlled by your medical direction. But to implement a level of classifications that we can, number one, aspire to achieve, which demonstrates the value that everybody's looking for to the customer, I think that that would create the environment to where you could go to insurance companies, both medical and life, and promote better reimbursement for the services. I think you could sell this to the cities, who could in turn market via Chamber of Commerce about the level of proverbial safety that you would live in these cities, and that we keep the same circular thing, what we're trying to solve of how do we get this all together? Well, we pull it all together underneath a protection classification, and then we market that. And then your individual agency can be rated at whatever level they wish to be rated at, which again turns into dollars. I'll yield it back.
Absolutely. And in the strategies, and I don't know who wants to work on that, but we really need to work on getting that vision of who we are, making them understand. And as actually Jonathan brought up the first week, we need to go back to it. We really need to define what that value is that we bring that is worthy for anybody to pay for us, whether it's the community, the individual, the leaders, the business leaders. We really need to drive on that under the strategies. All right, Nick, you're up. Let's see if you got your technology together.
All right. Can you guys hear me better now?
We can hear you.
Okay, good. All right. So one thing that technology is great when it works. So the one thing that I heard when Jonathan was talking was about the degrees and the principles, and I just wanted to touch on that lightly, and then I'll go over to the other stuff that I had put up. But you know, I'll be the first one to tell you, and before I used to be really afraid to admit it, but I don't have a college degree in anything that I do. I have an associate's in allied health science, which is just a generic coverall degree from UMDNJ. And, you know, I really more so learned everything that I got through training, continued education, and getting into the field and seeing it firsthand. And that's how I got where I am now. It's one thing that I can say is degrees are a way to test someone's ability to learn. And it shows you your ability to follow direction and take insight. And it does provide you with some background knowledge. But I will say people in the field that have been doing it for some amount of time have an upper edge on people with degrees coming out because they don't have that upper edge. They have a textbook knowledge. And textbook knowledge is wonderful, but, you know, applying business practice and real world practice versus your textbook information can really, there's a differentiation there. So definitely shout out to that. I mean, you know, EMS is a field too, and not to say that having a degree is bad, because by any means, if you have a degree and you're educated, it puts you above others in EMS that just get the certification and just continue on. It gives you a better edge to lead. But, you know, when it comes to the practicality of things, having the background knowledge and the base is where you're going to get a lot of your abilities. One of the things, I read an article and I was looking at it earlier this week, and it was actually from 2007. You know, it was from Scott Phelps, and it was about, I think it was called The Failures of EMS or something of that tune. But I took away like 6 key points that I had seen. One, the public has never understood what we do. And I know we touched on that, but from an EMS standpoint, they don't know what we do. They don't know the services that we provide. They don't know the extent of our training, our abilities. And, you know, the system is different in every state. So some are doing more, some are doing less, and some are doing completely, you know, different operations. And while they're all similar, everything's just a little bit different. And that I also think keeps the public a little bit confused as to the services that we provide. So there's really no unification there. We let Medicare pay for calls, but not the EMS system. And I want to elaborate on that a little bit. You know, when Medicare changes payment rules, you know, we essentially let them change from paying for patients pro rata and then went to the actual cost of the transport. And it kind of put a lot of overhead costs to the agency. So, you know, it wasn't exactly clear to like elected officials that we would really need to pay the rest. and then we kind of accepted mandatory coverage from Medicare, which essentially there was nothing that you could compete on anymore. So it kind of took that financial edge away from, you know, what we had set up as a system. And it's kind of a shame, because now, you know, you can't, billing for service is really like, you get a transport, you get a flat rate, and that's about it. And there's really no way to further justify that. It becomes a little bit more difficult. You know, so there's that. And then the other thing that I had in here, we let other disciplines do our jobs. You know, from an EMS standpoint, EMS is EMS, and those people should be handling that. You know, our EMS agencies, we should be looking at taking over and controlling that care. That's our mainstay. You know, EMS is our bread and butter. You know, and taking control of that and making sure that
we still got to get Madison.
That we are the face out in the community and making that step. And the other thing too is we never really asserted control over emergency medical care. Like as a service as a whole, you know, someone had made the comment before about there's 3 emergency services. I think it was police, fire, and trash collectors. And it's, you know, the way it's treated, it's really true. I mean, look at your states in the U.S. and, you know, what services are deemed an essential service. And a lot of them don't have EMS listed as an essential service. And I find that baffling to me. Because, you know, the services that we provide, nobody else can do that. You know, a trash man can't go and, you know, perform the procedures that we perform. They don't understand, you know, the things that we're doing. And that's on some parts from our own failure to unify and get out there. And the other thing is no more McJobs. You know, we kind of set ourselves up when everything happened to just kind of fall back and adjust to the economy and pay people the rates that we pay them. And it's really a shame because we're underpaying our people. You know, paramedics, they don't make a great wage, but they have 50 plus weeks of education in clinical diagnosis, in, you know, advanced life support, intubation techniques, all of this stuff that we're doing in the hospital. We're not paying them at an appropriate rate. The same goes for EMTs as well. You know, the pay rate for EMS is traditionally lower than fire departments and police departments. And I think it's really an undervalued service, especially for, you know, the services that we provide and the services that we could bill for. You know, it without all of the ceilings, you know, without having to shatter the ceiling, we wouldn't, you know, have that ability. So, you know, falling into that standard where people are making more money than us. I mean, the funny thing is, if you look at Burlington County, New Jersey, right, you look where I am, our EMTs average maybe anywhere from the $13 an hour, some even as low as 12, all the way up to 17 or 18 an hour. But, you know, you look at like an Amazon warehouse, that's a perfect example. The Amazon warehouses, those guys are getting hazard pay, double time, and they're pulling pallet jacks and packing boxes. Now, am I saying one's better than the other? No, but the work that we do versus the work that they do, the compensation should be significantly different. I shouldn't have to go to an Amazon warehouse to make more than I do providing critical care to a patient in the street, you know, with the limited resources that I have and the knowledge and training that I have for that rate. So that's something that definitely needs to be considered. And the other thing, you know, when we do 911 response, we don't really advertise ourselves as public safety professionals. We advertise ourselves as healthcare. And I think, you know, not that we're not healthcare, because we are, but we are public safety in the same. You know, we get out there and we ensure public safety. We're out on everything. We're out on everything from active shooter events to motorcycle accidents to, you know, cardiac arrests. I mean, it's all over the broad scope, looking for missing people. I mean, the brand of our service goes so much further than what we have and what we market ourselves as. So I think that those are just some considerations, and definitely a threat because we don't put ourselves out there the way that we can or should.
So before we pass it on, but Nick, and everything you brought up is spot on. My view of listening to what we've talked about in the last 5 weeks and today and listening, it's definitely a threat, but it goes back to we need to identify who we are, what we do, and we shouldn't be going, well, we're public safety or healthcare. For all of it, then let's say that's what we do. We do all of it. We need to better clearly define ourselves, put together our value. We need to, and one of the things I have concern, what is EMS? Is it mobile health care? Is it just ambulance transport? Is it an EMS? Think about it, emergency medical services. Is that the ER? Is that fire departments and police departments, because a lot of police departments do first responder. So we really need to do a clearly defining of who we are as part of our strategy, what our value is, who we are collectively, and that I like Alan Shaw's. We got to get that McDonald's branding of who we are. Then we can talk about how we're going to get paid, who should pay us, and also the ISO. We should have some kind of ability to and not compete against each other, but to say our system, based on this analysis of the performance of our system, this is what we're worth. One of the things that's crazy with me for ISO, right? ISO is for an insurance company, but we talk about fire department preparedness as opposed to talking about fire department reducing call volume, reducing emergency. And let's face it, nobody wants to deal with fire, EMS, and police unless they have to. They're necessary evil. So we should be looking how we could add value when we're not even responding to calls through prevention messages, public education, and other things. But it goes back to, in my mind, and you all discuss, we need to get back to who we are, what are the services we provide, how do we package that into a McDonald's brand that shows we have true value. And McDonald's brand really is one thing. I get two things. I get what I want cheap and fast. So that's not us. We need to figure out what it is. Who did I have next? I think I had John was next.
Yeah, Joseph next.
Joe,
and we've got to hear from Art and Zeke as well.
Okay, that's the order then.
Thanks, guys, and ladies. So talking about what just kind of expand on what Nick was talking about a bit. I don't think we're EMS anymore. The days of only doing emergency medical services for us are over. Originally, I would have told you that's probably about 5 to 6 years down the line, but this pandemic has thrust that to the forefront. And, a lot of the thing I'm hearing from our local hospitals down here in Houston, Texas, and I'm sure it's probably the same across the country, is people are afraid to come to the hospital. They're afraid to come seek medical care. STEMIs are down, strokes are down, cardiac arrest rates are up, out-of-hospital deaths are up. How do we get people? I was just on a conference call with our regional EMS group here today, and they were saying, well, how do we want to put public service announcements out to let people know that it's okay to come to the hospital and this, that, and the other. Well, who's the group that bridges that gap? And that's us. We're the intermediary between the community and getting those people into medical care. One of the things that we're going to start doing is starting on Tuesday, we're actually doing our own call line that we're going to do into the station for non-emergency medical care. And we're going to engage our community paramedic mobile integrated health teams to actually go out and supply the medical care for these people, because, just like everybody else has seen, there's people that are waiting till the very end to call the ambulance, and we're getting more and more sick people, more and more cardiac arrests, and more out of hospital deaths. And we are very uniquely positioned right now, but we've got to act upon it quickly to be able to prove our worth. And that's really where it comes into play here. Is nobody knows what we do. Well, now we have a great opportunity to show everybody what we can do. And that's kind of the mindset I think that we really need to have. And the struggle with that for me, and just listening to what you guys are saying, is without having some type of a standardization of how we do things across different areas. And I'll go back to our last talk I was on about the islands of success, that Jonathan brought up. That's the real struggle, so how do we sort of standardize what we're doing? How can we provide the same or reasonably same level of care across the country so that everybody knows that when they're engaging in EMS service or public safety service, that this is what they're going to get?
Well, it's a great point. And what I would say to you is, then, if we don't know, that's got to be one of the strategy groups, and we need to work on it. Just a funny thing, you were talking about how the hospitals are going, look, people aren't coming in, we got to do a big pub ed thing. New Jersey did it to promote EMS, to call the EMS, and they used all hospital people. They used the commissioner of health. They used all hospital people. They didn't use any EMS people. We continue to take that smack all the time because we're now out in front. And in my perspective, and I wasn't involved in it, but my perspective is that they should have been out there going, okay, here, Commissioner, here's a PSA we want to put out. What do you think about it? What do you say we do this? Instead of letting somebody else direct it. And I think what you guys are doing in Houston is good. And it gets back to, again, we need to have a basic menu. And I'm thinking out loud is when you do go to these houses for community paramedicine where it's less of a threat and less of an emergency, you should have just like visiting nurses do. Here's who we are. This is what we do. Here's all of our services. And by the way, if you know anybody else besides you that needs them, let them know. And we inform the family or the caregivers. And at least we're getting some start. All great stuff.
Yeah, and if anybody's interested in our procedures or anything like that, let me know. We have tons of guidelines, procedures, all kinds of stuff that we've been working on for probably the last 2 years. It may or may not work for you, but I'm more than happy to share any of that information with anybody that's interested. But you know, the big thing with us was identifying the community resources and getting the people bought in, getting the hospital systems bought in, getting
what is that?
all your resources
We're on our
as
camp,
much as you
the
can,
three of us.
so that way
Okay.
you have places to refer these people to, so that you know, and that way you don't have to go through the ERs when you absolutely don't need to.
Hey, Joe, can you restate? Sorry, guys, people need to go on mute, please, if you're not already. Joe, I missed about the last half you said. You talked about going to the hospital, and then I heard a bunch of different conversations.
No, I was just saying about if anybody wants any of our resources or any of the stuff we've typed up, you know, I'm more than happy to send that out to the group. But identifying the resources and forming relationships with community partners, like we have. We actually had a patient the other day, frequent fall patient that our crews go out to. I think our crews went out to him 6 times in a 2 or 3 week period. They sent a referral over to us. Our community team went out, and then we were able to get him a direct admit to an inpatient rehab facility without going through any transport or even a doctor visit. So that's kind of the stuff that we're trying to tackle. You know, your high utilizer people, and then now the group of people that are afraid to go and seek health care. They're not an emergency, but they do need some type of medical care, and that we can do that stuff in the home.
I'm going to turn it over to Art, but that's a great thing. It's like bringing the doctor with his little black bag back to the house. It's amazing how we're going back, and it's going to be productive.
But let me jump in. Let me jump in on that real quick and just tack on something we talked about last week. And I think it also goes back to our first conversation, is to the degree, Joe, that you are talking about sharing your insights with others, right? But there's also a necessity for us to share those insights with each other and the public, right? So to the degree that you come up with a success story, right? Or anyone on this call or anyone that any of us knows comes up with a success story, this question of if there is a consistent branded degree of excellence, right? The way, Tony, you just described the return to the house call. If that's something that's working well in Joe's community, everybody should be talking about that because it makes everybody look great, right? And that sense of a united front is a bulwark against people trying to understand what it is that you do when you didn't show up code 3. You showed up in a very different way, but it's still part of the gig. And I just think going back to, you know, how do you address these threats is by creating that united front that all celebrates what each other is doing. Sorry.
No problem. Good stuff. If you're not speaking, again, mute because we do have some background noise. Art, you're up.
All right. So as Jonathan knows, I like to throw snowballs, so I'll throw a few. Alan mentioned about in the UK, they refer to EMS as the paramedic service. And I think that's a great point to get to. We're talking about, are we transportation? Are we public safety? Are we healthcare? We can't agree what we are. Collectively as a group, we can't agree what we are, what we want to be. I'm gonna throw it out and say we're none of them. We are the service that provides care in the street or outside of the healthcare, the normal healthcare environment. So let's stop trying to be something that we're not, or trying to be part of another group. I think that's probably our biggest downfall, is that we keep trying to fit into someone else's rules and someone else's system. We are nobody else's systems. We're our own system, and let's be that system. So with that, I'll jump off and watch all the comments come back. I'm sure I offended somebody, but you know, I think we just need to keep asking the questions, and asking the questions of ourselves. You know, what are we doing? Why are we competing with each other? You know, and we do that all the time. We compete with each other constantly. And when I say each other, we're competing with all of the other, you know, services and providers that we keep trying to fit into their groups. And once we stop doing that, I think that we will find it much easier to grow what we are, and get to that parity of you know, not only service but wage that we keep talking about.
Art, let me throw a question at you to push a little further on what you just said, if you don't mind. Because yes, snowballs you do. That was the smallest snowball I've ever seen you throw.
Yeah. That. Come on.
Yeah.
No, but I think there's a deeper point. Let's talk about, for example, one of the conversations that comes up a ton. Obviously, we talk about degrees. We're talking about it a little bit in the comments here. You know, all you need to do is go to Facebook to see all the conversation about degrees, and they sort of devolve into this really weird formulation, by the way, about, you know, bless whoever that was. Okay, so you walk into the emergency department and the hospitalists don't care about who you are because nurses have degrees and EMS doesn't, to which I have pointed out that I've never seen a nurse ask to see what degree is on the badge or patch or name tape of the person walking in the door. I don't know how in general they'd know. There are people who don't put MD after their name. Like you know, it's just, you don't hand over a resume when you walk in the door, right? So when we talk about, the reason I ask this is because you made a point there around this idea that EMS is providing care elsewhere, right? If EMS is providing care elsewhere, and hospitalists, for example, provide care in hospitals, right? Then that essentially, by definition, makes the mobile medicine and the stationary medicine separate but equal, by definition, right? There's a Venn diagram. Somebody wrote in a comment above that the back door of the ambulance is the front door of the emergency department. So whoever that was, feel free to tell me who you were, but I noticed that comment. I wanted to call it out at the time. So back door of the ambulance, front door of the hospital. That to me says separate but equal. We bump into each other, right? There's a Venn diagram that crosses over like this, but there should not, by that measure, be any distinction about whether or not you're better or worse because you use Epic and you use something else, or your emergency department has wheels and my emergency department doesn't. Like, so why is it that we've gone to another layer? Let's go back to culture, right? Why is it that we're talking about things like degrees and inferiority complex, and I take orders from them, they don't care about me? Like, those have nothing to do with the nexus of where you provide care. There's something deeper, and I think the threat goes beyond what you're talking about to something underlying that. So how about if we plumb that idea a little bit of why is it that brand of we provide care where it's not stationary, which by the way is just a longer way of saying mobile medicine, why is it that that's not enough, right? Why is it that there's this sense of they denigrate us? We're talking about pay, which is its own thing, but we're talking about things like McJobs, which sounds derogatory, although if anyone has never worked at a McDonald's, that's a really hard thing to do. So push on that a little bit. Give me more about why we're, when we talk about where we work, that should be enough to set you on par with somebody who provides care in another location. But for some reason, that's not enough for this industry.
Because we're trying to be on par with who? And I know you're going back and talking about, when we look at, on par with, with nurses or with the healthcare system, but is that what we're trying to be on par with? We talk about, are we a transportation resource? Are we a healthcare resource? Are we a public safety resource? We can't become on par to an area until we decide where we are. And I don't think that we should be any of them. to be honest with you. I think we're our own entity because we do so many of those things. Then let's be ourselves and stop trying to be somebody else. And, you know, if you're trying to align with healthcare, part of what's driving that degree conversation is because healthcare is pushing towards degrees. I mean, look at the healthcare market overall. You want to be a physical therapist, you have to have a PhD now. So, you know, and that's just one example. That so if we're going to stay where we are and not advance, and we want to be healthcare, I'm not saying we should be because I don't think we should, but if we want to be healthcare and we don't want degrees, then we're going to end up being looked at as the orderly when you walk in the ER. That's just the nature because we're trying to align with something, but we don't want to play by their rules. So stop trying to align with someone else and not play with their rules. Let's be ourselves, make our own rules. That's just that. I guess that's the gist of where I'm going.
You know, Art, that's great stuff. Make our own rules to determine what education and knowledge base we need, not let somebody dictate it. Part of it, and it's not against them, but we have medical directors that are in healthcare and look at us from a healthcare perspective. Our industry has to determine, you know, not that it's right or wrong, but the fire service does NFPA and all this stuff. They self-determine their industry, and we don't self-determine our industry. And you have all great points that we should build on it in the future discussion. Who do we have up next, Jonathan?
Zeke is up next, and I think considering, are you the only attorney on this call? Probably.
I'm not your attorney.
That's true. I can't afford you.
Speaking under protest too. Well, I mean, I think the question is not a legal one; it's a political science one, and there's a very unsatisfying response to this. That I sort of have admit that up front, which is that I think that we assume that there's all this commonality and this common understanding and how things are chosen and to drive these things together. But and I would like to believe that as somebody who's been doing this a long time, but I think we have not done sort of the academic and then political lifting to sort of prove that that is the case. And so, one possible explanation, which has not been adequately explored, is that EMS systems have evolved in part because of local preferences, sort of under public choice theory. And if that's the case, and they do to some extent, or maybe very much so, reflect local preferences, which could include like, we don't give a shit about this or that, then, that's that could be quite problematic then for pulling a common thread through. And so, to many of my peers who make the argument that all that needs to be solved is for a federal lead agency to occur that will then tell us what EMS is. I mean, I think we might need to ask from sort of the core of where we were raised and where we operate, what is the thing about that's local? If it's about anything, I don't know. But, I certainly would say that somebody who is both got a pointy head right now and, who has done the thing both from the line and the chief slot for a long time, right? The word about mobile healthcare, as Jonathan well knows, I could give a crap personally, right? My sense of what EMS systems are about is very much determined by, being an unreformed Denver paramedic and an idea that what we do is we select for a staff that can respond very sort of efficiently and very leanly to scaling crises, and that's not even the same set of people by personality, at least in the part of the country where I am and I've done most of my work, right, as we would hire to, as I disparagingly refer to, check on grandma's bunions or whatever the current thing is. So, I think that the bottom line is, for me, I'm making the statement's a little bit inflammatory, but I think that we have a little better understanding maybe of how we locally create meaning, particularly with regard to the public, before we assume that we can make these kinds of field theory statements. So, in terms of putting this in the theme of the day, I mean, I don't think that this exercise is by any means worthless that we're going through here. I wouldn't have spent, time even on the phone. But I think the threat here, right, is that I don't think we actually know ourselves very well. And I mean that in sort of a local sense. And that understanding is critical. And so I don't think we actually understand the relationship with the people we serve or what they see. I mean, we make statements all the time about, this is what EMS does or doesn't do, and this is what the public perceives that we do or don't, and put them in, and I see them in the chat. And I'm not saying I don't make them, but I don't make assertions about that all the time. But I think we actually have no friggin' clue what why these systems have developed the way they have and whether there's any order to it or not. And I think it's pretty hard if you're going to come and speak with your own experience and come together and say, well, what are the common threads? If I could say, well, these things in the Denver area ecosystem are a result of pure chance or political accident or weird evolution or compensation models. And these are things we tried and that the public wasn't interested in at all, or whatever, right? If those evolutions, if I can come and say that and you can say the same thing to me, but well, we don't have that here because our public doesn't actually give a crap about that. Well, then we can identify which things are actually common elements or not. And so I think that these are kind of fundamental questions that the time and energy has not been spent to explore. I mean, the reason I put the Robinson thesis in the chat the last time is because that really represents a 25-year conversation between James and I, with my pushing back on his idea that there could be a field theory that could be developed federally. And so he had to come up with some academic model for what that would be about. So he used boundary object theory, which is an interesting way of thinking about it. And, and Jonathan, did you want to hear more about boundary object theory? You were acting like you did last time. But
no, I find, first of all, I think you and James are some of the deepest and most forward thinkers on these types of topics. And I think most of the people on this call, actually, just seeing the names who are here, probably would be very interested in it. At least if you can, to summarize it, and then we can look further. But I think one of the things that what you're highlighting is what Tony has been talking to me a lot about in Sidebar, which is that we're going to translate these four conversations on the SWOT analysis into tactics, right? It has to become some kind of order of operation. And I think so much of what you just talked about is that sort of, what do you translate these ideas into things that can be spread out, engaged locally. It's not just 30 plus, whoever guessed 30, by the way, we're at 30 right now. I think we hit 32.
30.
All right. It's not just the 30 or 32 people on this call. It's the idea that each of these, what is fascinating, Zeke, is to look at the people represented on this call and realize the sheer extent of the geography represented on this phone call and on these last four conversations. And so to take back what you're talking about the local bit and be able to say, how do these conversations engage in our communities, then bring them back and consolidate them, and now actually finally have that picture that you were talking about that really doesn't exist. But we've got the gumption, and everyone on this conversation has the goods to be able to reach out some tentacles within 100 miles of their geography. We're going to cover quite a bit of this country. So anyway, I do think that there are some very deep thinkers on this call who would probably love to know a bit about what you and James were talking about.
Well, the way boundary object theory is useful here, and I mean, I'll let you. You should read the thesis. I think it's actually really quite good, and is that boundary object theory has interesting dimensions, and James makes arguments that EMS is both a boundary object and it's not, depending on which layer you look at it. But it's this sociological concept that evolved out of the Museum of Vertebrate Zoology at Berkeley, and as I understand it, basically, they had volunteers that did taxonomic classification of animals, right? So they had a discussion and sort of dealt with collection aspects. And what was determined was that there was in the object, there's common meaning, right, that is created that allows you to move to sort of an end, but it's not necessarily at all shared meaning, in the sense that the understanding of the object is completely different across the different populations. So you're able to get to an objective and sort of combine forces, if you will. This is Zeke's poor articulation of boundary object theory, by the way, folks. But the idea is that you might not actually have sort of a common theory of how the world operates at all. You just have this sort of thing you're able to operate on in the middle. And so it's an interesting model for thinking about where we have or haven't evolved, because I think it goes to this point about, well, when are we talking cross purposes and when are we not? And then, even if we're not talking cross purposes, could we be talking together in a way that sort of achieves one particular aim, but doesn't actually provide us the theory of what the hell we're up to that's sort of sustainable and moves us down the road? So it's a really interesting way of thinking about how we might take the material, to your point, Jonathan, if we're doing something here that comes out of these conversations, and think about whether, when we're looking at the same page in front of us here with this threat SWOT, right? Does it mean the same thing to all of us, in enough of a way that could get us somewhere?
Well,
So,
and we've talked now, and I think we talked about this in the weaknesses section as well. You can remind me, Tony, but language was a huge bit, right? The idea of a common lexicon and the lack thereof, because even words like reimbursement mean different things to different people. They mean different things in English that they do in healthcare. So to the degree that, I think what I take away from what you're describing is the idea that we may see commonalities that either mask more difference than we think, right? Tell me if I'm wrong here, but either there's more difference than we recognize because we're overlapping, sort of have the words are evolving to overlap, but they don't necessarily mean the same thing. Or the opposite is true, that we're actually using different words, so we don't realize we have as much commonality as we in fact do. And if you could create some cross glossary action where you end up aligning your lexicons. I think earlier in one of the sessions, someone talked about Rosetta Stone, and this idea that you have some. In fact, I know I talked about the fact that there are departments of public safety that operate EMS, fire, and police all at the same time, right? That those become kind of a Rosetta Stone for us to be able to say, how does an understanding in one discipline work in the other? And I think you've also, I know Ren Neely, I think you also have a overlapping public safety, right? Public health and public safety background. I'm sure there are other people on this call who have police jobs or police type jobs that they've done. So I think tell me if I'm wrong, but is that sort of where you're talking about, sort of where those lines blur? Is opportunity for misconception, but could also be opportunity for stress testing and understanding in one place and seeing how we need to make it work for the others as well, which could take something from California to the East Coast to Texas to the North and be able to say, how do the same words need to be adjusted?
So, they're all really great points, and having worked in 3 different states and understanding the discussion, are we all really talking on the same page, even though we're using the same words? And they may be different. A couple of things. One, you go back to your early thing. Do we, and I've done this before, do we go out and ask our public what they really think of us? Do we really go out and engage them and have a conversation through surveys in different ways so we understand who we're dealing with? Same with those that pay for our bills, with whether it's the elected leaders or whoever. And the next thing is, we see, from my perspective anyway, I see commonalities that are out there that I think we need to start at least trying to put some stuff together and then see, does it work? Does it compute? Do we all understand what we're talking about in the same way? And if it doesn't, then we got to go down that rabbit hole a little bit further. But we're at least moving somewhere right now that we've, with this small group of 30 out of 100,000 EMS providers, we're starting to move somewhere. And, we have some great concepts that are going on that I do think we could share. Will they work? I don't know. But, it is a good point that what we do locally, it does not always transmit globally and vice versa. And, but I think we just got to go down that rabbit hole and see where it takes us. I like that paper. I think we should share it and we could all look at it and say, hey, how does this translate? And we could work a little harder on making sure our communications as common as we possibly can, so we really understand each other at the same level or wavelength.
Well, just to give a final response, I mean, Jonathan's asking me if the understanding is correct. I think that that's not the framing that I would use in terms of whether or not your understanding of boundary object theory is correct, or whether whatever is that I'm making an argument here, and I think this overlaps a little bit with what you just said, Anthony, that one of the difficulties about this way this process is being run, if you will, right, is that it's deductive, and I think we do that a lot and we're good at it. But maybe we should, and this might go back to your degree argument or what's the role of academic thought, there might be some value in really backing up and trying to also introduce something more inductive to this process. Because I think it would be interesting to find out what the response might be to, does boundary object theory help us understand why we will or won't succeed here in sort of finding those commonalities? Does public choice theory help describe what's going on? Because I mean, I think if people could agree, like, well, why are there so many differences and why can't we reach any agreements? Well, it's because actually public choice really matters, and public choice theory is a good way to understand EMS. That's an interesting beginning point that we don't presently have, right? And so I would suggest that maybe, you know, I don't think it should take over the whole endeavor, but I think that this is, you know, that this is one of the things that academic thought and inductive reasoning are good for potentially. And we have not, you know, I would argue that EMS as a disciplinary area, if it is one, has not done sort of the academic work that way. And so maybe we should try to attach it to some of the, you know, public policy, sociological literature you raised earlier, Jonathan, right? Org theory. I mean, there's things that are here. And if we could find common anchor points, you know, again, like we think public choice theory describes a lot of EMS. Well, that would be a really actually an amazing beginning point, because that's just a, you know, a hypothesis I advanced today and have been advancing for a while, but seeing where we work on it. So I think I would be reluctant, Jonathan in particular, to say that, you know, that interpretation is right or wrong. It's more an issue of, you know, does the theory have any value to us?
Well, I was trying to understand if I was understanding it correctly. It is a complex discussion, but Tony, this gets to it's an interesting thought that just popped into my head. Maybe we should create a reading list with a variety of papers and other things, books and so on. Here, Mike, Mike, I think you're Michael Teague. I think you reached into my brain clearly there as I just said that. Well, I just saw your comment here, the EMS PhD programs. We could probably delve into that, but you know, a lit review strikes me as something that might be very appropriate given what we're talking about here. And I think everybody on this call is clearly self-selecting for having an interest in these types of deep thoughts. So Zeke, if you could pull up some of those papers, send them to me, make sure I have them. I'll make sure they get disseminated. But I think there are also others. I mean, some people have been asking me in the last day or two for data-related papers. You know, again, how not the really just, I guess, how things are getting applied, and to make sure that we're merging both the philosophical and the tactical. But you know, how can you have these sort of depth of conversation if you don't have a depth of history as to sort of where things got to here? And I'm not talking about the bickering. I'm talking about the political theories that you're talking about. Things wonderful. Eric can't read. Nice. We'll get you a book on tape version. We'll have Zeke can narrate them for you.
I'll get on the audiobook right now.
What?
I'll get on the audiobook right now.
I think
in response to your question, I mean, I think it's another approach rather than the reading list per se would be I propose to you that the Robinson paper is actually a good place to begin, and that actually his literature cited list is quite excellent in the literature review in terms of, you know, because it narrows down to the public choice and org theory stuff that he thought was relevant to that conversation. So maybe a snowballing approach might be more realistic given the amount of time everybody has to engage things.
You just get me the links and I'll make sure we get it out there. Thanks.
You know, it's a great conversation, and we'll have to add it and make things a little bit more complex, but hopefully it'll make things a little bit more valid. And just again, so everybody understands before I turn this over to Britt's next, is, you know, this just started out with, hey, you know, where are we going after this pandemic? Are we ready for it? And how are we going to plan to transition out of it to evolve into a better place and to get some brains to think about it? So that's where we we got this conversation going, and you know, nobody endorses us, but you know, how far we go with it, or how far it evolves, or what direction it evolves, is all up to us and how we utilize the information. With that, Britt has a couple things to say. Britt, you're up.
Thank you, and I appreciate the opportunity. This is a great venue for everybody to get together from around the country, and have different perspectives. Earlier we were talking about the benefit. Are we a health benefit? Are we a transportation benefit? And unfortunately, on the federal levels, Medicare and including the ICS, EMS is listed as a transportation benefit. Period. They don't even acknowledge the fact that we or even any way or shape, form, do anything medical. I mean, not even CPR. They don't even acknowledge that part. It is strictly the same thing as a taxi. So that is a huge hurdle to overcome. And it's not just going to be based on education. I know that that's been forefront for several years, is that if we increase the education component and made things where they were more of a degree, then that would push up towards the salary, and then give us more respect on the healthcare side and give us a little bit more leeway. But I beg to differ with that. I'm not that I'm against education, but there's no such thing as there's no really, as far as I'm concerned, or as far as I know, there's no such thing as a degreed firefighter that is the one that's defining that firefighters fight fire. And maybe I'm saying that wrong. I mean, I do realize that there are degrees in both firefighter, EMS, and public safety. I'm strictly saying that it's not simply an educational component. It's bigger than that. It's going to have to be on the federal side.
You know what? You make great sense. Firefighters could have all kinds of degrees, but it doesn't define. And even in officers, they may ask for you to have them, but it doesn't define who you are, your position, like it does for a nurse or a doctor or a lawyer. It doesn't. It's added education. If anything, it's nice to know stuff.
Yes, and again, when I first got into management, I quickly realized, up until that point, I thought EMS was a system that provided quality pre-hospital medical care and happened to transport patients to the hospital. It wasn't until I started getting into the management side and had to start dealing with some billing issues and learning some, on the federal side, that's not the case. We are a transportation benefit. We just happen to also provide quality medical care in that time frame.
Good point. And again, it goes to understanding who we are, what we want to, who we are, and not knowing who we are. To a point that concerns me a little bit. I'm more just me, and we can expand this discussion, whoever's going to go next. I just think we need to put more worry or more emphasis on who we're going to be. Where do we want to go? What I like to start from the outcome. Where do I want to be, and then work backward how to get there, and find all the ways to get to yes. Work through the difficulties, the discussion, the dissension, the obstacles, and how do we get to yes to who we want to be. And going to earlier discussion, maybe we don't know who we want to be, but we need to have that discussion. Who do we want to be? And collectively be able to, again, market ourselves as Mick, whatever we are, and have a brand that we could, at least the fire service has, and police has some collective identities, because there's more than one, that you can go to any community and they clearly understand what they are. EMS, not so much. A lot of places we're still ambulance drivers, and services are delivered and so is fire, but it's just delivered in so many different ways. It's hard to have a focus on who we are. So as much as I'm worried about who we were, who we are now, who we were, I'm really, one of our things to look for the strategies of who we're going to be, what's that going to take to be us, and what are we going to provide, and how are we going to have a value for our community. I just want to go to a little side. When I first started in EMS, we did a lot of stuff. and we treated a lot of stuff in the street. Now, evidence-based information and research says, well, you know what? Instead of treating a trauma in the street, get them to a hospital. Instead of treating an MI in the street, get them to a hospital. Instead of treating a stroke in the street, get them to the hospital. And I understand that's best practices in care, evidence-based. But we do little as EMS to say, what can we do to be better at that? What can we do to be better in the street? What other things could we do? Or pre-hospitally as mobile healthcare, you know, community paramedicine. But what are we doing to enhance our ability to provide more service? Instead, we go, because the medical community drives. No, we just drive real fast, drive an MI real fast to the hospital. No, we just drive a stroke real fast to the hospital. No, we just drive a trauma real fast to the hospital. And that's not going to get us anywhere. That's right. Who's sponsoring the research? It's a good point. And you know, unless it's a doc somewhere or a medical director that drives it, there's very few places that EMS is driving their own research. But you see nurses, and even the fire service drives their own research. Heck, as an EFO student, I have to write my own papers about the fire service. So, you know, just a consideration of who drives us now and how do we get out from under that wing of whatever it is and be our own selves. So I'll leave it with that. Who wants to go next? Who's up? Who?
If it's all right, I'd like to follow what Britt just said with some of what Amy put up in the Facebook group. I know you said you wanted to put that in here a little bit.
Right.
I think it's a perfect opportunity. I'm just going to read it. I'm not really going to judge it. But I think it speaks to this conversation of unity of voices. And again, to bring this back to the hashtag unity, the mission here, to come to ways where we can find the common ground. So here's what she wrote. I'm teaching tomorrow, won't be on the call, want to send some comments. Number one, IAFF/CFSI. I left a link to their combined efforts to educate stakeholders and legislators about the differences, she puts differences in quotes, between fire EMS and various other EMS delivery systems. It's an example that those groups may not be willing to partner and would actively oppose EMS in our efforts. Okay, and she puts a link. Number two, organizations that won't want to work together for a variety of reasons. Number three, leadership of current organizations we are attempting to join together and their willingness to join a larger group or be influenced by their own biases and their group's biases. And number four, providers believing that there could be a group to address EMS issues and provider issues at large and their biases or willingness to put them aside or join such a group. And I think Britt's comments are the perfect place to put that. And I know, Tony, you said you might need to go. If others...
I pushed my meeting back.
Oh, fabulous, fabulous. Great. And I'm actually excited. If Dave's going next, I'm here excited to have him jump after this point because he is, if those of you don't know, again, you're talking about deep thinker in EMS-based or fire-based EMS. Dave is definitely one of those. But I think there's not a lot deeper thinkers than you on this, Dave. And that's on record now. Everybody here knows it. Bar is very high. It's like yay high. So, but what I think is a really interesting point, Britt, is that you and others have mentioned about federal anything, right? Requires a lift, and the going back to this cultural question of is EMS culturally inclined to negotiate with one another? Are they culturally inclined to find common ground, or to say, if you don't want me to share in your football, I'm going to go get my own football and I'm going to go find myself another field to play on. And what you end up doing is destroying your ability to get to a critical mass where that voice is loud enough to be heard, right? So you end up with 50 little groups. I mean, there are some states, Oklahoma, I think, is represented. I know Jim is on this call, and I think there's some others as well. Eric, you mentioned Oklahoma City. I've seen that. Oklahoma, I think, has 3 different EMS organizations, like associations. I don't even think we have that many in California. We got a couple more people than Oklahoma does. So the idea that you've kind of got this internal splintering of power. And so I'll leave Dave to talk, and then I want to talk a little bit about tactics since we're getting to the end of the 4th stage SWOT. And so talk about what comes next, but this idea that if we could wrap our arms around the splinter groups, not requiring them, to give up their areas of focus, because clearly those people are passionate just like we are about their topic, right? If you're talking about the medicine, or you're talking about the standards of practice, or you're talking about what's happening in your state, etc., you clearly care about such topics. But combined, the strength is more than just the sum of its parts. And how can the change, Britt, that you're asking for and that others are talking about ever occur if none of the voices is individually loud enough to raise? And that's what the fire services have done very well. And when Amy and I were talking about this yesterday, and for over an hour, one of the points that she made is, even within the fire service, you have local ones, of course, but you have the IAFF and IAFC, and the local groups like California Fire Chiefs affiliate sort of one way or another with those broader groups to some degree. But when it's an issue where IAFF and IAFC need to align, they drop the last letter of their acronym, right? So it's no longer labor and management. You're always going to have labor and management in any organization of any size, but they dropped the affiliation of their role and they become part of a fraternity. And EMS doesn't do that yet. But I think when we talk about the tactics that can come out of this, and it's why I keep giving the kudos back to Tony for having done this, he and others have made points that they have been working on this for a long time. But the yet is part of that. And what we have represented here is a collective of people at a different time with the background of a crisis and changing CMS rules and all these different things. And if we can say, what if you can now take these different interest groups and wrap our arms around them? And then you have people like Dave Moffat who can see both sides of that coin. So I'm going to shut up and leave to him. But I find this very, very encouraging that challenges like the ones that Britt and others have been pointing out here can be solved if we work together. And then the question becomes, what does that working together actually mean? And then we get into Tony's tactical conversation.
So
You're up, Dave.
thank you. And thanks for the introduction like that. I've got a few scattered thoughts, and I'm going to try to bring them back together. And I'm running about 4 hours sleep and a lot of caffeine, so bear with me here. Since we're on the topic of threats, and we talked about the role of academia, and we talked about where in the medical spectrum that we exist, what our identity is. I think if we drift too far clinical, then there's going to be some outside pressure upon us to start taking on role and mission that is not what EMS is supposed to be. But I think if we do not try to rise above the ambulance driver, then we're not going to go where we need to. We're not going to be paid commensurately, recognized commensurately. So there's a place in there that we belong. And so I'm leery about the tension that exists out there for other people to define what they think we are. And here's an example. So tongue in cheek, I'm going to say, when people talk about first world problems, I'm going to bring up big city problems because I work for a fire department in a big city. And in just under a niche area to talk about, which would be behavioral health, and I get in front of outside agencies and clinicians to talk about this, I want them to have a realization of where the problem starts when it's the fire department EMS level. So you have someone that is they're starting off at whatever age and whatever stage of life that they're in with their behavioral health. And there's safety nets that are there, but some of them will get caught. But at the fire department or EMS level, some don't. And so those stages are that they're up high, and that level would be friends and family that are looking out for them. And so either they don't have a good safety net of friends or family, or they begin to alienate those people for whatever reasons, and not that I'm assigning blame there, but they descend. So now they descend, possibly if they still have a job, to their coworkers. Below that, they begin to couch surf. After that, they're drifting in and out of government programs, and they eventually even alienate maybe federal and state level government programs, and they become homeless, and now they become dependent upon the 911 system. And at least where I am, because I don't want to make assumptions that everybody's backyard is like mine, that in the Phoenix regional area, that when you call 911, you get the police department first. And the question they ask is 911 was your emergency. And if it sounds like a fire or a medical thing, then they transfer you one more time, and that's to the fire department. And that's where the fire department dispatch comes in. And so when you look at the hierarchy of the descent, we are at the bottom. And there's nobody underneath us. We're even underneath the police department. And when people that have behavioral health do not get great care necessarily from us, because it's not what we're built for, but they still call us because there's no one underneath us. Well, I've begun having conversations with those other different levels within my community. And it's funny because their assumptions are, well, if things just go bad, we're going to call 911, or we're okay with people calling 911. And so the regional behavioral health authority that exists within my county, which by the way is a 5-year contract, and it's worth $6 billion with a B, $6 billion. And I think, and no one's going to come out and just admit this, but and it's not that they're lazy, it's not that they're not effective. They're taking 26,000 calls per month for service there. But I think some of those people that are counted in that 26,000 don't get what they would define as what they want. And so they hang up and they call 911. And so there's some duplicity of dispatch and certainly duplicity of effort that takes place in there. So from my level down at that bottom at EMS is pushing back up and saying, well, now that I have this awareness that there's a $6 billion industry that's out there, I want some accountability. And again, I'm talking from the large city, large fire department perspective is those calls fall to us, but sometimes they don't belong there. And it's the failure or the lack of responsibility of those other levels in between that now make it seem like it's the mission of the fire department, but nobody on my job, and we've certainly had a certain level of behavioral health training, and we're sympathetic to these people, right? We would never just not go on that call and not create referrals or take them to the hospital or whatever those are. But I submit that mission is not ours. That's someone else's. So uniquely, another battle that we've been fighting that is almost like this and has really come to the forefront within the COVID pandemic are senior care facilities. And so when people don't get good care within those facilities, or perhaps it's family that comes into that facility to check on people, there has not been a lot of accountability within the facility, right? So they call us because we're the problem solver. And if there's a problem we can solve, we work on that, put that person in the ambulance and take that person to the hospital. But it doesn't fix the upstream problem of the lack of accountability within that bad care facility. And it doesn't seem like the mission of the fire department, but sometimes we have to go and get to state and local level jurisdictions having authority over licensing and supervision over these facilities and give them an awareness that there's a problem. But it doesn't look like that's, it doesn't look like the mission of the fire department. So as everyone's watching TV and seeing that some of these care facilities are failing, and I've been digging in just into the media excerpts to read, some of them are failing because the labor force has gotten sick and it's wiped them out. And there's no roving pool of labor force to come in to take over for that. And then some of it is that some of these people are afraid or they're overworked, feel undersupported, and they just abandon. And so here in Phoenix, I can imagine that family member is going to walk in and say, wow, I called and I couldn't reach grandpa. I tried to reach some of the staff here at this facility. No one answered the phone, and now they're walking in. And in some of these places, I think Massachusetts was one of them, family members walked in and there were dead bodies there and no help. And so the natural call that they're going to make is 911. And so that first, if it's a fire truck that shows up, that first company officer gets there, he's going to have to set up the incident command system and begin triage and here. So I'm actually developing a protocol on behalf of the city on how this works. But the funny question is that I have to ask, and I have to get in front of these state agencies and tell them, did you know that it's not the mission of the fire department to run long-term care facilities? And I would think that'd just be an academic question to them, because I'd say, you know, the moment that we identify that there's a problem and we take this on within the incident command system to bring stability to this incident, I'm going to start making phone calls. And I have a certain expectation that someone's going to answer the phone at 2 o'clock on Christmas, 2 o'clock in the morning on Christmas, because that might be the time it happens. And so I need to know who I'm going to eventually turn this scene over to stabilize this, because it's not the mission of the fire department. So it's starting to go down a tangent, and I apologize for that. But the pertinence I bring to this is I think that the state here is a little too comfortable with the fact that they don't want to create policy and get in front of these problems that this COVID pandemic has brought to the national forefront now. And they're not managing their risk very well, and they're deferring that responsibility to an agency that's not built to handle it. My point to bring this all home is that I think that in that defining ourselves between the ambulance driver and some very expert clinician at perhaps a mid-level provider area in there, is that if we're not careful, other people will define our roles for us, like local government sometimes will, in a role that we probably had not anticipated.
You know, Dave, that's outstanding stuff. And I've been thinking for years, it's been my mind, is that we're the gatekeepers for everybody that, and above and beyond the fire, just for patient care, whether it's mental health or physical issues, we're the gatekeeper. 911's called, and we have to figure it out, as you said. What continues to, and it's an opportunity, we should have an accountable care organization that deals with all pre-hospital issues. All those people that don't fit into the round peg, that doesn't fit into the square hole, etc., and have an accountable care where all of those agencies you talked about that don't do their job sit at the table with us. And here's one that really should be sitting and listening to us, is the insurance companies and anybody that pays for any of this, and say, if you let us provide you some insight and perspective and listen as we collectively work to manage these issues, we'll save you tons and tons of money while providing better care all the way throughout. And sometimes it's just getting those people in the room with you and going, did you realize this problem? No, I didn't realize. Did you realize this? I've thought that way back where I was in Bristol. We were the epicenter for small towns per capita for heroin overdoses. And instead of doing anything about it, Narcan in the ambulance, go to the hospital. Narcan that was not the pathway out. They needed to have somebody intervene once they were awake, or even if they were awake, to take them down an alternate pathway to get them into the treatment. And whether it's drugs or alcohol, mental health, we have the ability to bring everybody together and sit them in a room all collectively. And there also, as you point out, there's got to be some kind of parameter that says, you didn't meet your standard. You didn't meet your standard. What are we going to do this? But we can't continue to do it. We don't, as you said, we don't have the expertise to do it. We can funnel them to the right places. We know we're great at triage, whether it's fire or EMS, we're great at triage. So let us help you do that. And we can train our EMS personnel how to at least triage, but we shouldn't be stuck with them and taking care of people that we don't have the knowledge base, the training, or the resources for. And it's an area.
And maybe not the authority.
What's that?
And perhaps not even the authority.
Agreed. But if we could sit all of those groups and agencies in the same room on a monthly basis and say, how do we address this? What do we need to do? Here's where this continues to fall through the cracks. This is where we have a problem. Do you realize what our training our people have, and they can't do this? I really think that's the way. And I've talked about doing these EMS accountable care organizations. And in fact, we even had a meeting in New Jersey, and people alleged that they were doing them, but it hasn't happened. And those accountable care organizations are supposed to be through the federal government to improve care and quality and reduce costs. but I just wonder if anybody in EMS has even looked at it.
I think you also have to think about that gets us back into the question of who's going to be sitting at the table from the mobile healthcare perspective. In the instance of Dave talking about big city fire, those guys can get to the tables because they have the political clout already. I live in New Hampshire, pretty close to you, Anthony, and we were, Manchester was the epicenter for the Northeast region in the opioid epidemic. And the person who was sitting at the table making decisions was the Manchester City Fire Chief, an EMT basic with no EMS background in a fire department that doesn't run EMS. But he was the EMS spokesperson because their city is AMR run for 911. So we need to be able to have the ability to get our leaders at that table and have the people in the room respect their opinions as well. It's more than just getting there. They have to be listened to. And I think that's part of the challenge.
I think that the challenge is getting in front of that with a unified voice before that meeting occurs.
Yes.
Right. I agree. And, and it's not just on the local level. That's, again, where we got to go to the national level and be able to talk to insurance companies and CMS. And a lot of, it was asked before, how did EMS get into communities? It was the federal government. There was a white paper in 1976, and then they threw a ton of money at all the states and said, you have to build systems, in order to get to this money. So it's the same thing. It's money driven. And if we could get to the right people to say, look, we have some solutions we think that will work for you, that will accomplish your goals for you, they might listen and actually start going on a national level to not just the office of EMS, but other offices, mental health or whoever, the hospital association, and go the nursing homes and look, we think you need to put together this ACO, and here's the issue that you're going to be dealing with. Here's what you want to try to resolve and provide better outcomes off. So I think we need to go both ways. And just so you know, Scott, in Bucks County, it was the district attorney that took all the money and did it, and EMS, wasn't asked till way late in it. And it was somebody that was up in the northern rich end of the county that wasn't down in Bristol handling 3, 4, 5 overdoses at a night. So I'm with you, but that's one of those weaknesses that we have to address. Agreed. Who do we got up next? Anybody?
So I want to touch on something. I threw out a quote there after Dave's. Dave and Scott, I think, both made this point, and I think it's interestingly relevant, again, as we sort of shift the focus a little bit in the next few minutes or last few minutes of today towards tactics. It's this quote from the movie The American President, if many of you haven't already seen it. Kind of old movie. It was a precursor to The West Wing, which I confess is my favorite show. And yet, Dave Moffat and I are dear friends. And yet. So here's the quote. People want leadership, and in the absence of genuine leadership, they will listen to anyone who steps up to the microphone. I was a reporter. I'm still a reporter. I've been a reporter for a long time. And it is sort of the first rule of media training is you're never officially off the record. I mean, you can say you are, but as soon as something comes out of your mouth, it's fair game. You never know whether a reporter is going to be ethical about that or not. And so this conversation, as Scott points out, is someone stepping up to the microphone and Dave talking about the idea that if you don't define yourself, somebody else will. Ryan has said similar things, and I think it's also apropos that he is someone who, like me, is quite politically engaged to the degree that we have the stomach for it. It is on the one hand the idea of acting as if somebody is watching, right? Acting as if you are going to be held accountable for your work. I've heard some people have mentioned a little bit during the last couple of weeks, but it's definitely come up in other forums that, again, for all the talk about professionalization of an industry, you still have people with the bumper sticker that says, I Narcaned your honor student. And it's one thing to be funny, right? But there's a difference between inside messages and outside messages. There are the things that you talk about inside the station, the things that you talk about in a private sidebar. You're realizing that sure, that can get out, but it's better than having it in a public group where everybody can see. And I'll tell you, I won't mention names, but I was quite disheartened in the last couple days when a dear friend who is in a leadership role, and he's been through a lot, so I, personally, I have a lot of empathy, but he he put out something that was kind of a joke, but it was focusing on like the dead end nature of EMS. And it kind of killed me a little bit, because this is somebody that is in a leadership role. And even though, again, he's been through a lot and I have a lot of empathy for what he's going through, you are somebody who also has an appellation after your name of being a leader of a group. You have to be the guy who's standing up at all times, realizing that as a leader of people, you have to be the guy, right? Because that's the message that people are going to see. And I think, again, going back to things like, oh yeah, well, it's on your list here, Tony. You've got on your threats list, culture, branding, looking for an argument instead of solution, knowing how people see us. Some of that boils down to morale, right? And this idea that if, you got Scott on one side of the country and Dave on the other side of the country, basically saying the exact same thing, which is somebody stepped up to the plate. And is that person stepping up to the plate the person that should be, and we feel comfortable representing, or being the poster child for a discipline? And if that person was, are they conveying the message that we want them to do? And so I think one of the tactics that kind of can come out of this, Tony, out of this conversation, is almost something like a speakers bureau, right? I have found that there are different associations around the country who are led by people who have stepped up to the microphone, but that doesn't mean they're right. It just means they're present. And in some of those cases, I've been the guy to go after it and sort of say, well, you may be present, but you're wrong. And that either matters or it doesn't matter depending on your geography. And again, I try to have deference for the fact that some of the people in this industry have been doing it for a very, very long time. But Tony, I kind of wanted to pitch this to you and to Ryan, and to others on whoever else wants to jump in. But to the degree that one of the tactics that we come up with, I've noticed that the Facebook group has been a little bit quiet. It's mostly me kind of poking on stuff. You mentioned PIO training, so public information. Okay. But should we have, I don't know, is it worth, convening papers? Talking about research, for example. Should we make a concerted effort that this group or a member of this group with a hashtag or two submit a paper on this topic to every conference that we know of, right? I mean, assuming that we don't need to create our own conference, because everybody's welcome to come out to California, by the way. I'm happy to buy you drinks. We have cool wine.
Jonathan, why can't we create our own virtual conference? I like the idea of a paper. I got through 4 of them somehow, some way, and I know there's many of you here that are much better than that. But I'll tell you why I'm not suggesting that. It's simply the idea of, I think there are a lot of conferences. There are enough. Trust me, you should look at my balance sheet this quarter, because I can't travel. My numbers look amazing. It is possible to go broke going to conferences in this industry. They overlap a ton, and as I've mentioned, I have problems with, for example, some associations will only allow you to take a stab at the microphone if you've paid dues in that organization, which I think that's a corruptive influence. It basically says we only want to talk to you if you've been self-selecting to pay for this, which is not the same as opening a big tent. But if we recognize the idea that those associations exist, that conferences like GEMS and EMS World and Firehouse World and these different, the various state conferences exist, what if it becomes a tactical decision from this group? We got, now we're down to 18 people, and people had to go, but we had 38 people last week. We had 32 people today, and 170 people in a Facebook group, and all of the people that they're connected to. And that at least one, if not more, topic related to unity, to the common threads, becomes something that gets submitted to every conference we can think of. And then all of a sudden, there's this underlying message that sort of gets pounded into people's psyche. And rather than cede the microphone to the people who continue to get asked to do it over and over and over again, and I don't have a problem at all with Matt Savatsky. I think he's brilliant. But if you have the same person who's talking at every conference, it's going to be sort of the same message in most places.
Dave, Ed Rock from AMR, wonderful speaker. Does he have to be the keynote at every conference? Not sure. So to the degree that there are some brilliant names, but we need to have some genetic diversity in this industry. And maybe that's one of the tactical takeaways here, because again, in the absence of leadership, people will listen to whoever picks up the microphone. So what if we end up ensuring or doing everything we can so that everybody on this conference, with the exception of me, because I grab the microphone, what if people step up and grab the microphone? There are a number of people, and Dave, I am looking at you, and Brian, I'm looking at you. Literally, Dave, I see you at the bottom of my screen here. But there are some people who are being identified by their departments and by their regions as leaders, but it's quiet. Actually, Gail, before you leave, I'm going to call you out again. Gail is a perfect person to talk about this before you leave. When Gail speaks at the California Fire Chiefs Associations, people listen. And I don't know if she realizes just how quiet everybody gets, but when Gail speaks, people listen. And yet she's not the person to step up and say, give me the microphone, I'm going to talk until it's her turn. And maybe we need to try to invert that and make sure that people who believe in this unity concept and believe that there are things, by Gail, by the way, that there are other messages worth talking about than the ones that get the microphone by default. What if we insert ourselves into that conversation and exert that leadership? Anyway, at least that's my part.
Having put in for EMS today 6 times, and some of you have done a lot better, for a New Jersey EMS conference 5 times, and I get picked for fire conferences, but I don't get picked for EMS conferences. And it's not just about me, but the point is, if you're not meeting, I spent time with unnamed people at a certain conference in Tampa in March, the pre-meeting, and there's agendas. There's agendas, whether it's GEMS, EMS Today, the New Jersey conference, that they want their people that sound cool, that bring people in a room, that will spend money. And it might work down the road. I think if we put something together and try it out on each other, we might be able to do something and maybe get some of the people that have a name that's in there. But you know what? Some of you might meet it, but I'm not Dan Gerard. I'm not Mike Taigman, and I'm friends with Mike and some of the others that regularly get chosen because they're in with the crowd and they draw people in.
But let me interject on that a little bit, because I think those people, well, talking about the money is a little bit of a question now, and I think it's relevant, but especially in the age of COVID, that's gone away a little bit, right? Much more virtual stuff. But again, I think there's an answer to that threat as well. And look, I'm somebody that people likes to say I'm trying to sell something, therefore I shouldn't be able to speak either, as if my degrees and credentials in publishing have gone out the window because I run a company. None of you has heard me pitch a product while we've been on 4 weeks of conversations here, right? So I think there is the answer to that, Tony, is have we positioned ourselves to be the ones judging the submissions, right? So are you, is it Alan, are you the one who's involved in AAAs? Someone who's involved in AAAs. Anyway, maybe, I don't know if it's this week or last week, but there was somebody who was involved. Oh, Eric, okay. So if you're involved in AAA? So putting yourself in a position to be able to have a voice when it comes to selecting the presentations is an important part of this effort, right? So, joining, not only, there is something to be said for change from within. And I think that's an interesting part of this bit is, are we talking from the outside, or are we convening our own group? Okay, those have value, but at the same time, if existing structures like, again, EMS World, EMS Today, and various state organizations exist already, basically saying, I'm not going to participate in you, a boycott works, but only if you get everybody to go with you, right? Otherwise, you're the one who's sort of standing out. But what if we put ourselves in a position to be the ones to judge? And I can tell you that happened to me. A number of years ago when I was in publishing, and it's happened now in some other things, it happened with the American Public Health Association a couple weeks ago. I signed up, I volunteered to be someone to review abstracts. right? So to the degree that I submitted some as well, but I'm also helping to steer the conversation by recommending that a certain quality of research is getting reviewed. When I was publishing digital magazines, and then the Magazine Publishers of America came up with a digital content category, they reached out to me and I volunteered to judge, right? So if you put yourself in a position to be able to help to steer that conversation, then Tony, I think the papers get to start, they start to bleed over. So you're not pigeonholed anymore because your allies who think like you, who are part of that 170 people on the Facebook group, are in a position to be able to say, Dan is wonderful and Mike is wonderful. And by the way, we need to hear from Tony now. And again, I think that's one thing when I call out Ryan, like he is a person who always holds himself up in such a manner of saying, I will volunteer to be a part of a conversation. And you're not going to find a whole lot of reasons to throw me under the bus because I hold myself I hold myself to a very high standard. And if we do that for ourselves, then it becomes harder to say, you know, you shouldn't be given the microphone. Sorry. No. Go ahead, Tony.
I agree, and we'll move this on because Mike Teague has some good stuff to say, as well as Eric and a few others. Again, understanding what goes behind, and especially in the big ones, they're owned by large corporations, and it's money that gets them in. And the important conversations that we should have, that we're having now, are not interesting to a lot of people. So one fire conference that's going to be online, I saw all the people that they have, all their pictures are dirty, gritty firefighters. Now, some of these guys are very smart leaders, got education, got background, but the image they went to sell this is dirty, gritty firefighters because that's what sells. And we need to we need to first develop what we have, make it worthwhile that people go, this is important, this is going to make a difference, and we'll utilize it, and then maybe we can try to go to the big conferences. I mean, there's a couple of them on here that already have some insight and maybe can get there, but not all of us are going to have what they want for their product to do that stuff. You know, and the only EMS conference I got into, by the way, is because somebody I met on Facebook actually recommended me, not going through the regular vetting process. And again, some of you do go all the time, but even the topics that they make sure that the topics that they speak on sound like they're going to sell. Again, let Ryan and who else? There's a couple other, Mike Teague speak. But I think it's a challenge getting there until we have a little bit better of a product that we can provide to them. And I think that'll start next week. Mike Teague, did you want to add to it?
Sure. A couple things I was thinking about. One is I know Jonathan and I have been hammering on data. The problem with data is data doesn't convince people. It just allows us to tell a story that we can use. There's plenty of research out there. And the best example are the anti-vaxxers. I can tell them that research shows that vaccines do not cause autism. However, that's not going to change their mind. And the research in psychology is really pretty good on this, that data doesn't change people's minds. So we need people to be able to tell the story. And that's an important thing. And one of the parts of telling the story is to come up with reasons against why what we're saying isn't true. So my idea is that not only do we need a group to get together and put together some type of proposal, a document, but we also need a separate group that looks at that proposal and document and tries to poke holes in it. It's called red teaming in most stuff. And the idea is you approach it way different than the people who wrote the document or wrote the plan. Todd Coughlin calls it pre-accident investigation, and McChrystal Group just did a thing about pre-mortems. Taking whatever plan you come up with and finding a group of people to poke holes in it. Because if we don't do that, then we're going to run into a situation where we can present all this information to people and they're going to say, well, that'll never work. So we definitely have to come up with a way to look at this both on the, we should do this, but what are the reasons why everybody says we can't do this? Is it because fire, EMS, privates and publics, hospitals, and everybody can't get along? Because we can't. We've shown that through the years. We're terrible at work. And you can't be a member of American Ambulance Association if you're a fire EMS agency. They won't accept your membership, right? So they attack us, we attack them, everybody gets pissed off in the end and nothing gets done. So we just need to come up with those things and figure out how to avoid the attacks that are going to come as soon as all this information, if we start presenting it. And the conference thing is huge. I mean, I know exactly what people were saying about getting in, and it's difficult, but the best way that I think to do it is, you know, the magazines and stuff are always looking for people to write articles, and the best way to get into their conference is to write articles. And if you keep sending them these articles, then eventually you'll get into the conference system. I mean, that's how I had to do it to get into FDIC.
Agreed. And actually, Bobby Halton told me more than once, having presented there 3 out of 5 years, that you got to write, So I agree, Mike, writing's important. But the key thing you said in this is, once we vet this out internally, you got to write a story. You got to make a catchy story, make it interesting, that catches the ear and the eye of, wow, this is why I want to go to it. I mean, in reality, no matter how important and valid the information is, if it's not a story that people want to hear, then, you know, they're not listening. So it's a good point. And I like the process. I think you take it another step. You put together our product, and the red team goes over it and looks at it and says, this is all the issues that we need to resolve. This is what we need to resolve before we get to yes. And then have a third group say, how do we turn this into a story? Anybody? Thoughts?
On that front, I think that I'll just echo the comment I just wrote up. I think I love the idea, by the way, love the idea. It's essentially peer reviewing, Mike, is I think what you're talking about, right? There is a question of, again, how well at a cultural level, how well does this industry take criticism? Right. So to the end, but I think that's real. Right. Again, like I don't like your feedback, so I'm going to start my own association. Well, maybe you didn't sell the point, which is why we didn't go with it. I mean, there is some of that, and so I think it's a little bit of a fine line. It does involve some self-reflection and some strong medicine sometimes, but I think, you know, that's, again, in the journalistic world, since you're talking about writing, that's what an editor's job is, right? Is have you told the story? You may think that your words are wonderful, but if you haven't made any sense of them, maybe you need somebody to judge that and feedback. And are we, and I think this is a question not so much to be answered now as to think about, but do we take criticism as an industry, or do we get defensive and, you know, believe that we're being attacked and being thrown under the bus and so on and so forth? So I think, Mike, I think your question is perfect. And I mean, taking that approach can end up with some very strong, battle-tested views of things, right? That will stand to outside poking. But it also requires folks to have a thick skin. And I don't know that everybody in this game does. I think Art made the point earlier that people self-select to be in this industry. And I think that's very true. But they you know, we also talked a lot last week and before about resilience. And resilience is a very big part of that. Can you have your ideas challenged and not take it as an attack on somebody coming after you and saying you're less than, as opposed to saying, well, I'm actually trying to make the argument stronger so that, you know, it'll stand to challenge. Is that a place that we are?
You know, I see us, and please somebody else jump in. I see us kind of like the Dead Poet Society. We're a group of people that we have while we all come from affiliations, we're not representing anybody. We're not representing AAA. We're not representing Phoenix Fire Department. We're not representing anybody. But we have a background in this industry, and we understand it fairly well. And different people understand different parts differently. And collectively, we could put something together that doesn't, you know, we could look at the whole industry in an honest way and not worry about how does that affect me personally? How does that affect my organization? It's how does it affect the whole industry, and how can we get to yes, or whatever that yes is that we're trying to get to. But, you know, we're just a bunch of talent that has decided to do this, and nobody has to like it, no, but at least I believe because of the people that are on it and the involvement, people will take notice once it's put together and packaged in the proper way. But I wanted to make key that let's not look at this as IFC, IFF, Phoenix, Thorn. We're a bunch of collective people involved in the industry that have an interest and have certain skill sets and knowledge bases that collectively we can make something that is usable for the whole industry. And maybe the whole industry doesn't use it. Maybe only 20 of the 30 or 40 people on here do. Maybe only 10, but at least we got to vet some thoughts and ideas, and down the road we might be able to utilize it individually in our organization or collectively in our bigger organization. But let's not look at, hey, we are the industry. Ryan, you're up.
So one of the things I'll kind of add to that, we've obviously got a group of people who's been very consistent over the last few weeks, and I like to think that we have similar mindsets. We may have different ideas about how we would go about getting to different places within the industry and making those changes. But I think collectively we've got a really good idea and pretty much a good vision collectively moving forward here. So one of the things I think we can do, talking about getting into conferences and instead of being rejected, being accepted to come speak and being part of the bigger discussion here, is we can kind of work to promote one another. And so I think over the last few weeks, we've all connected. A lot of us, I know I have at least connected with a lot of you on LinkedIn, on Facebook. And quite honestly, it's been really kind of cool to get to know all of you, even though virtually, and looking forward to eventually running into you at conferences and whatnot. But I think now that we've kind of built a stronger network here, now our challenge to one another is to now go out and promote each other. So like if Jonathan, let's say you go ahead and post some kind of an article on LinkedIn, for example, we need to all go on there, like, share, talk about it, get the discussion moving forward, because we all know that we're relatively like-minded. And so why don't we support one another and try to build a stronger, more unified voice just from the 30 to however many participants we've had over the last few weeks. And I think that's a great starting point for us to kind of build the foundation for a bigger amplifier that goes with our microphone.
You know what? I actually thought that earlier. I saw Eric said exactly what he was going to say. It's perfect thing. We all have things that we do that we can share. I was thinking, and all of you are doing some stuff, great stuff, but the stuff that Dave Moffat's doing, if that could be couched to what they're doing in Phoenix and what you're doing in North Carolina and vice all over the place, I think that would really help. Plus, we get to know each other a little bit better, and that helps us have a better understanding of how to work collectively. And I don't think we're all yes people. We all want to get to the same outcome, but we're challenging status quo collectively. I find this as a collaborative group that is a loose-based coalition, if you want to call it, and we continue and take it wherever it runs to. Eric, did you want to add anything?
Yeah, just to echo what Ryan said, what you said, and Jonathan in particular, and then Alan and everyone else. Really, what I see and what I'm hearing, which is fantastic, is that the opportunity for all of us to work well within the constructs of our own systems, but yet be interested enough in the enhancement or the betterment of everyone, using best practices and what things are working well here, and understanding that we want to be critical of these thoughts and initiatives. The red team, Mike, 100%, we're not going into this thinking that we are better. We know that we have to be critical of one another, but yet the key right there is the support of one another and accepting them, like Ryan said, and I know we said last week. And that's what is just, again, I said I was fired up last week. I'm even more fired up because the voices are being heard and people are feeling represented. And there are speakers here and those that are willing to take this forward, but there are people that need us to do that are getting online, 48 at the beginning, and maybe not having enough time to say, get their words in. But this is something that if we don't continue to support each other, but get critical of one another, and having to have that thick skin that was mentioned earlier, we're going to keep that arrow as straight as possible. and refine it as we need to, as we start to look at and examine and reflect upon where we want to go. And like you said, Anthony, earlier, we have to define and have some of those things. Now we have to have measurables to make sure that we're staying on track and accountable. Just like if we're doing a grant and we get the grant, we have to make sure that we're meeting the objectives of the grant. So I'm going to shut up. I love what people are saying and doing. And even if there's things that blow my mind, because I'm like, how can we do that? It's causing me to research more, to learn more, and dig deeper. So thank you all.
Yeah, great stuff, Eric. And the thing I want to talk about challenge and what we've done so far has been respectful. And I saw a little bit in the Facebook group, and Jonathan, you might disagree, but there are a couple of little, like, instead of being respectful, like, where do you get that point from? Well, where's that come from? People are being catty, if I guess I can't think exactly the word, instead of going like, I'd like to learn more. Where's your perspective? And as earlier said, we get defensive and right away we want to respond how we're better. And it's kind of like the Dunning-Kruger thing. There's a whole bunch of Dunning-Krugers out there, especially after the pandemic come, that they're all smarter than everybody else. Nobody here is smarter than anybody else. Everybody has something to contribute, and some people know better in certain area than other. But we're all looking, and again, if you look at tribal leadership, it's what a stage 5 tribe does. We all play off of each other's strengths and weaknesses to drag everybody, forward. Jonathan, Red Sox Nation, really. Remember Bill Buckner at 86 World Series? That's all I got to say. But anyway, we just got to keep doing this and put together a process for next week for strategic planning. I don't think we're going to get to actual plans. I think we need to come up with a process of what we're going to do and how we're going to do this stuff. So whatever we do becomes valid and not just a bunch of people that had nothing better to do on a Friday getting around and sitting in front of a computer. Just my thought on it.
Well, I think it's, if I may, I think it's probably a perfect place to pause.
Right.
Especially since the comments have just gone into baseball, and I think that's a challenge beyond our abilities on this group. But Tony, I think that's going forward next week and beyond. We'll be focusing on tactics, and I think we've touched on a number of those today. So thank you guys all. I mean, I got to jump. I mean, if everybody else wants to stay, obviously you guys feel free.
I got to go. The last thing is, again, email addresses, because this presentation and the document that goes with it, as well as the Dropbox account, which has all the videos and the group chat. What do you call this? The group chat compilation is all going to be there. So I want you to be all able to have that access into those folders. And the only way we're going to do that is have your email addresses. So Jonathan, if you have people's email addresses, you can either send them to me or start putting them in Dropbox and putting them in the Google Drive folder, because I put everything in a folder today. So
Bobby, you got it.
That's great. And we can go from there. If not, I say, go Scott. I say, we break from here today. Everybody have a great day and enjoy, and we'll all catch up next Friday.
Thanks, guys. Stay safe. Thanks for being here.
Bye.
Thanks, everyone.
Have a good weekend, guys.
Thank you, Alan. Michael.
I like the courteous fisticuffs. I like that one. Okay.
Be well. See you, Alan. Thanks for your points today, man.
Oh my God, Scott with the background.